In a baby before birth, a small blood vessel called the ductus arteriosus helps blood bypass the lungs, as oxygen comes from the placenta. Normally, this vessel closes soon after birth when the baby starts breathing on its own. But in Patent Ductus Arteriosus, or PDA, the vessel stays open, allowing blood to flow abnormally between the aorta and pulmonary artery. This causes too much blood to go to the lungs, leading to breathing difficulties, poor growth, and sometimes heart failure. Symptoms may include rapid breathing, poor feeding, fatigue, or even a heart murmur detected by a doctor.